How's it going, guys? We have a past level question for neuro/embryology. 16-year-old boy, okay? He's got bitemporal hemianopia. They can tell you patient has problems seeing signs on the highway. They can tell you that they're bumping into walls, pillars. So we're not making that hard. It's bitemporal hemianopia. And you obviously know that that refers to a lesion of the pituitary. Okay, so we're asking you the most likely diagnosis here, and it's embryo. Choice A, second pharyngeal arch maturation is wrong. You do not have to obsess over the arches for USMLE. When we talk about embryo, you've got pouches, which are endoderm, arches, mesoderm, and grooves, and clefts are the same thing, which is ectoderm. Okay, and so if we want to get real nitpicky, things like the first arch relate to cranial nerve 5. So like the muscles of mastication, as an example. When we talk about the second arch, things that relate to cranial nerve 7. So the platysma, it's one of the neck muscles. For whatever reason, it's innervated by the facial nerve. The stapedius muscle, okay, it contacts the ossicles, the middle ear bones. So if they gave you a problem, let's say with the malleus incus or stapes, if they want to be really nitpicky, you would say, well, stapedius, smallest muscle, it's innervated by cranial nerve 7. Cranial nerve 7 relates to the second arch. Okay, so it's not that this stuff can't show up, but it's nitpicky. Wrong fucking answer. Choice B, third and fourth pharyngeal pouch migration is wrong. So I think most of you are probably able to eliminate that one. That's clearly DeGeorge syndrome, 22q11 deletion. DeGeorge/velocardial syndrome. But the third pouch becomes the two inferior parathyroids in the thymus. The fourth pouch becomes the two superior parathyroids. So DeGeorge, you're going to have T cell deficiency, and you're going to have hypocalcemia because you don't have parathyroid glands, in addition to heart defects like tetralogy of Fallot, persistent truncus arteriosus, facial defects like cleft lip, cleft palate. Wrong fucking answer. Choice C, ectoderm of anterior pituitary is wrong. It's a bit tricky. This is craniopharyngioma because we have a kid here. They want you to know that age 17 and younger, the most common lesion of the pituitary is craniopharyngioma. 18 and older, it's prolactinoma. Craniopharyngioma is not technically a pituitary tumor, despite being at the location. The correct answer is E, rufa primitive oropharynx, which refers to Rathke pouch. Ectoderm of Rathke pouch, it'll migrate to the area of the pituitary, but it's not technically derived from the anterior pituitary itself. So choice C would be correct for prolactinoma. If we literally just gave you an 18-year-old instead of a 16-year-old, choice C would be correct. It's literally that simple in terms of a cutoff. They want you to know that. Pediatrics, 17 and younger, it's going to be craniopharyngioma instead. Rufa primitive oropharynx, rufa primitive oral cavity is the correct answer. I'll come to D in a second. Okay, so craniopharyngioma, they want you to know it can have squamous epithelium, it can have cholesterol crystals, it can calcify, and if it's resected, it has a high rate of recurrence. Prolactinoma, this can cause galactorrhea in both males and females, impotence in men, amenorrhea in women. So let's just finish off here. Choice D. So we said E is correct for craniopharyngioma. Choice D, and for the elephant in the room case, we have to go back to preschool for a second. The reason you get bitemporal hemianopia with anterior pituitary lesions is because you have impingement on the optic chiasm superior to the sella turcica, which is where the pituitary gland is. Okay, so that's your bitemporal hemianopia there. Choice D, endodermiform cecum is wrong. This refers to thyroglossal duct cyst. So for whatever magical reason, when the thyroid gland is developing embryologically, it starts at the base of the tongue. It's called the Borman cecum endoderm, and it's going to descend down into the neck. Okay, so sometimes that descent can be disrupted, and that's where you get the painless midline neck lump that can move upward with swallowing / protrusion of the tongue in about 4 out of 5 vignettes. 1 out of 5 vignettes. They might give you a 3-year-old where they have a midline neck lump that they don't say anything about it moving upward with protrusion of the tongue with swelling. They don't say that. But instead, they can tell you a technetium 99 scan shows uptake inferior to the hyoid bone. That's one way I've seen an NBME question. Choice D, wrong fucking answer.